Today's guest has been on a few episodes of the podcast and has over 30 years of experience as a practitioner treating conditions like Candida, thyroid disorders, leaky gut, IBS, hormone imbalances, geriatric nutrition, and more. Today I have with me Dr. Michael Biamonte. He is the founder of the Biamonte Center for Clinical Nutrition, and he's the co-creator of Biocybernetics. We talked about this in previous episodes that I will link in the show notes. This is a computer software program that can study the blood work, mineral test, and other lab tests that an individual has to determine exactly where the imbalance is occurring in the body. Dr. Biamonte is dedicated to improving the lives of his patients and helping them to get back to living. He holds a doctorate of naturopathy and is a New York State certified clinical nutritionist. He is a professional member of the International and American Association of Clinical Nutritionists, the American College of Nutrition, and is a member of the Scientific Advisory Board for the Clinical Nutrition Certification Board. Dr. Biamonte, welcome back to the show.
Thank you, Carol. It's great to be back.
Well, we have quite a few really interesting talking points that I think are going to resonate with the listeners today. And I want to start out, I want to dive right in with long COVID. We've been hearing about this for a while. They were saying, oh, it doesn't even exist. Now it's being acknowledged. What are your thoughts on this? Is it from the virus? What's going on here?
Long COVID is interesting, and I was interested in it, and I decided to find out what exactly it was. So we grabbed a bunch of people who said they had long COVID. They fit the criteria for having long COVID, and we tested them. And what we found out was that it was not the COVID virus that was causing the problem in present time. What happens when you get COVID is that it exhausts your adrenal glands. So essentially, long COVID is adrenal exhaustion that occurs in many people. We also found something else about COVID is that COVID causes Candida. There's a Japanese study that shows that COVID itself killed the bifidus bacteria in your colon, which allows Candida to grow. So we found that amongst the people with long COVID, it wasn't their imagination. There was definitely something wrong, but what it was not the virus continuing. It's not the virus, it's the effects of the virus that there is an aftermath where the virus either causes Candida in people or causes adrenal exhaustion or both. And that's what long COVID is.
Interesting. So it's not the COVID virus itself, it's kind of this domino effect of what it's causing in the aftermath. And why is it hanging around so long? Why are people struggling with this for like years?
It's because they don't know what the problem is, so they can't treat it correctly. I mean, obviously, if you can't identify a problem, you can't treat it correctly and you can't get anywhere. If you continue to blame the virus and then really not do anything effective, it's going to stay there. So the person who has long COVID has to handle their Candida, and then they have to handle their adrenal glands, get their adrenal glands back. And the funny thing is that if you have Candida, Candida continues to zap your adrenals. It stresses them. It diminishes their function. So even if a person knew their adrenals were exhausted and they tried to treat their adrenals with vitamins and glandulars and herbs and all this, if the Candida is still there, the Candida would be diminishing the effects of their treatment. So the person with long COVID needs to find out, did I develop Candida from the COVID? And then handle it, and then treat their adrenal glands, do some tests on their adrenals to assess the function, and then get on a proper adrenal program.
So it's kind of twofold. Is it just
Mm-hmm.
affecting the adrenals, or is it causing Candida? Let's kind of back it up one step because some of the listeners, they might not be that familiar with Candida. Maybe they've heard the term, but they don't really know what it is.
Right. So Candida is an organism which lives in your intestinal tract. In fact, it lives in the intestines of all mammals. It's a fungus, but it also can convert itself to a yeast. It's the same organism that gives women vaginal yeast infections or gives people thrush when their mouths become white and furry and painful. But most people are probably going to know it as being the organism that causes a vaginal yeast infection. The Candida lives in your intestinal tract. The fact that it causes a vaginal yeast infection is an extension of its, let's say, life. But primarily it's found in your intestines, in your small intestine, and your colon. And it's the organism in your intestines when it grows out of control that causes the bloating, the gas, the indigestion, the food allergies, the food reactions. It causes fatigue. It causes a whole slew of symptoms. And it's unfortunate, but a lot of times Candida grows out of control due to the use of antibiotics. Most people nowadays have heard the term probiotics. Well, the reason most people want to take probiotics is to keep under control and keep suppressed these bad organisms that are in your intestinal tract, like Candida. Probiotics suppress Candida. But if something happens to disturb those probiotics, if those probiotics in your small intestine or your large intestine are somehow compromised, if they're killed off, the Candida then automatically grows and takes over. And it causes then the whole slew of symptoms that it's famous for causing. Typically, the first thing that happens when you get Candida is you start to feel fatigued and sort of unexplained, like, why am I tired? Then you start noticing digestive problems, bloating, constipation, gas, bad reactions to food, bad digestion. Then, as it continues, it can cause many different symptoms depending on your genetics. So, it can cause eczema, it can cause psoriasis, it can cause rheumatoid arthritis, it can cause a whole host of symptoms that people end up on medications for, not knowing what the real cause is. So, this Candida is what COVID can cause as a side effect.
So it's affecting the Candida can affect the adrenal glands, correct? So you get that
Yes.
fatigue.
Yes, because Candida, the adrenal glands are part of your immune system. Most people don't know this. But the adrenals are part of the immune system, and they're also part of your stress system in your body. Your adrenal glands make different hormones. Like most people, when they think of adrenals, they think of adrenaline, which is your fight or flight. But there's a whole bunch of other hormones that the adrenals make that help your body deal with different levels of stress on a daily basis. And having Candida causes those glands to exhaust because the Candida is putting stress on your body in a different sense than what most people might think. Most people think stress, they get really mad, they start, yelling, or they get something like this. But Candida puts a more subtle stress on your adrenals, that your adrenals are producing hormones to try to adapt to. And after a while, the adrenals exhaust because they're also trying to stimulate your immune system to kill this Candida as part of the immune function. So the constant presence of the Candida and the constant stress that that's putting on your adrenals eventually cause your adrenal glands to exhaust. And when you think about chronic fatigue syndrome for a second, the original model of chronic fatigue syndrome was the Epstein-Barr virus.
Mm-hmm.
Then, as we became more sophisticated, we realized it wasn't just the Epstein-Barr virus. There were other things that were causing chronic fatigue. But one of the first things we noticed is that the Epstein-Barr virus wiped out your adrenal function. So even after the person got through the acute phase of the virus, where they were feeling like they had the flu and they had all the acute symptoms, like mono, for instance,
Mm-hmm.
mononucleosis is the acute stage of Epstein-Barr. So when that passes and the virus starts to come back from time to time, then that's called more Epstein-Barr. But when you originally have the virus and it's really bad, it's mono. Now, that virus being there constantly taxing your immune system also wipes out your adrenal glands. So this is one of the first things that we discovered in the 80s, was that the chronic fatigue syndrome wasn't just having Epstein-Barr, it was also having exhausted adrenals or exhausted hormones. Like if a woman has her estrogen and progesterone crash, if a man has his testosterone crash, that could be classified as chronic fatigue. And very often it's from these very same things we're talking about, some kind of chronic infection, whether it's Candida or Epstein-Barr or whatever the infection is that eventually wears out those organs and glands that produce those hormones.
Interesting. Now, you mentioned the hormones, and it was a question that was kind of swirling through my mind as you were talking. We have a lot of listeners, they're in perimenopause, menopause, way post.
Hmm.
And at that juncture of life, especially like right around perimenopause, you start to have that problem with stress. Like we don't handle stress as well; it has more of an effect. And then there's those changes in the gut microbiome. So, do you see more like long COVID and more of these types of symptoms in midlife women or women beyond?
No, I wouldn't say when it comes to long COVID, no, it can happen to anyone, unfortunately. Young, middle age, or older people can all get long COVID. As far as hormone imbalances as you get older, that's definitely true. And as you get older, because your glands are getting tired, you're losing nutrients, you may not absorb nutrients as well as you did when you were young, then your hormone systems start to go down. Unfortunately, there are many complications to this, and the environment is the major one. If you look at RFK Jr.'s work, he's trying to save people from all these complications of environmental toxins that are causing this to happen prematurely in people. So it's a set of things that can occur. Your biome, if your biome goes off, it affects your hormones. That's a key point. There's an interrelationship between your biome and your hormones. When your body makes hormones, your body stores the hormones to some degree in your intestinal tract, and it shuttles the hormones back and forth into your bloodstream as you need them. But in order for it to make that exchange, you have to have a correct biome. You have to have the healthy bacteria there that allows your body to exchange the hormones or shuttle them in and out. And if you don't have that good biome there, you don't. So the hormones just either stay there or they become inactive, and then your hormones crash. You functionally have a hormone crash. So these are all the factors involved. Unfortunately, it's gotten more complicated as years have gone on. And one of the major reasons for that are the plastics in our environment. Yes,
Mm,
GMO foods are bad and are involved in this, and medications are involved in this beyond what people know. Um, but plastics in the environment are a big problem because these most of the plastics in the environment mimic estrogen.
hmm
So they'll either cause women to become estrogen dominant without even knowing it, or they'll cause men to be more estrogen dominant than they should. A lot of men don't necessarily have low testosterone. You see all these ads on the internet, on social media for all these products. Some of them have it right, some of them don't. But a lot of men do not have low testosterone. What they have is elevated cortisol, which is the main stress hormone that crashes when you get chronic fatigue, or they have elevated estrogen. So, and this is why you're going to see products now, herbal products that they advertise that lower both estrogen and cortisol in men, because those are the things that are blocking or suppressing your testosterone from working, and that's what's causing the hormone crash that the people have.
mm. I know that they've seen it in younger men that have post traumatic stress disorder, like they have served in the military. They come back with this diagnosis. Is that linked to the cortisol levels being, chronically high?
Yeah, well, that's an extreme case. That's a good example because that's an extreme case. There you have people who were put under incredible stress and then exposed to all kinds of horrible chemicals that were used in warfare. So you have both things going on there. They're chemically toxic and they had unbelievable stress, and it elevates your cortisol, and those chemicals probably elevate their estrogen. I don't know what chemicals specifically we can talk about because there are many different ones that have been used
Hmm
in warfare. But I can tell you that as far as domestically in our country, the plastics are a huge problem because the plastics mimic estrogen, and this is why we have so many. This is why we have young girls going through puberty at such an early age. You've heard there was a term a few years ago called premature puberty, and I think they've changed the name a couple of times. But essentially, where you see women going through puberty much earlier than 20, 30 years ago. Girls are getting their periods at 8, 9, and 10 years old. And then on the other hand, you have men who are in their 30s who have erectile dysfunction, or their sperm count is too low for them to conceive with their wife. And this is all due to these plastics and these chemicals that RFK Jr. is trying to rid us of, essentially, to make a long story short.
Mm. Yeah, the plastics drive me crazy. They are everywhere. For anybody who's ever tried to like rid your life of these, I did this like maybe 3 years ago. I went through my house and I was just stunned. It was just everywhere. But then you get it out of your home and I mean, you're getting a receipt from the store, or all of your food is packaged in these little plastic bags and whatnot.
Yeah, it's a power. What you're saying is true, but it's interesting because it parallels climate change in a way that you just can't get away from it. As much as we might do in this country to try to help climate change, if China isn't on board with us and doing the
Mhm.
same thing, and other major countries aren't doing the same thing, what we're doing here is a joke. It's a total joke because it just gets you could say that the chemicals and the toxicity from those nations just drift over to us. So of course it's good to do something about it, but you got to be realistic and be practical in terms of what's going to be effective. And we, like in my home, my wife and I did the same thing. We went through everything. We tried to get rid of as much plastic as we could. But as you said, you still have foods coming to you that are packaged in it. And then you have our dear friend Bill Gates, who comes up with this product called Appeal. Have you heard about Appeal?
No, I have not.
Oh no, well, Appeal is a sort of like a coating that gets put on food, technically to preserve the food and make it last longer. But when you actually study Appeal and you study the effects of it, it's disastrous, particularly for people's hormones. It's a hormone disruptor. So and it's even being allowed to be put on organic food. Now, luckily, they're labeling it. They have to
Good
label
Lord.
if Appeal is on your food. So if you're buying organic food and Appeal is there is a way you can find that out in the supermarket by looking at the different codes. But I don't know, when you talk about Bill Gates, it doesn't make too much sense to me to take any kind of health advice for someone who openly and publicly talks about depopulation of the planet. Now that's very necessary. So,
Goodness. Yeah, and you're talking about these barcodes. I mean, most of us are not going to even know to do that or take the time, or we're looking at it, we don't know what we're looking at.
well,
So,
this is
yeah.
in the new era that we now have. This is what has to happen.
Oh, boy. And you're right about, if other countries are if they're putting off things into the environment. I mean, we all share this planet, and like it or not, we're linked together. I mean,
Hmm.
it just is the way it is in the modern world. We
This is
are linked.
yes, AT&T
Absolutely.
would say we're all connected.
Now, with Candida, with other types of gut health issues, it can be really overwhelming. So I had a GI map. I had maybe, I think, I don't know, three over the past few years.
Hmm.
And it's great information, but it's so overwhelming. So you'll see maybe some candida overgrowth, dysbiosis. A lot of people have parasites. They don't know that they have parasites. What is the best plan? What's the best way to test? And of course, I know the approach is going to depend on what you find, but how can we kind of simplify this so it's not so overwhelming? Because I think sometimes people don't get treatment because it's like,
Hmm.
oh my gosh, where do I start?
That's a good question. I don't know how you can simplify it, but there is an order that you have to address these things in, and this to some degree can simplify it because if you don't follow a particular order in addressing things, it's not going to work. So, when a person gets a GI map, if it shows several pathogens and then it shows a lack of friendly bacteria, the person is going to be instinctively taking all that friendly bacteria, those probiotics, and then he's going to look for things to kill the pathogens. It doesn't really work that way. The friendly bacteria can't come back into your intestinal tract until you eliminate the pathogens because the pathogens repel the probiotics. So the first thing you have to learn is, and it goes back to, well, back in the 80s, we had a program, we were calling it the 4R program, which was first remove. So you first remove the bad organisms, then you reimplant the good ones, And if you don't go through that sequence, it doesn't work. You take all these things and you end up not getting anywhere. So if you look at a GI map, you look at what your key pathogens are, and then you target those with specific medicines, whether they're prescription or herbal or whatever the person's using. But you have to eradicate those pathogens first. Then once the pathogens are eradicated, now you work on balancing the biome. And that's where you need to look at well, there's a couple of ways to look at it, but one viewpoint would be you look at which strains of friendly bacteria you're low in and then try to replace them. There's also a bigger picture, because when you look at all the different strains of probiotics that exist that the companies talk about, my company makes this product and it has these strains of probiotics at certain billions of count and whatnot. In reality, if you take the basic strains within a reasonable period of time, the other strains automatically come about because they mutate. And this is a good mutation. So when you hear about L. reuteri or Rhamnose and all these different bacteria, well, those bacteria are going to come about in your intestinal tract if you have the right prebiotics there eventually, just as part of the natural evolution of the basic lactobacillus species and the bifido species. So you don't really have to get selective, although the companies that sell the products are going to tell you you do. You don't have to. What's more important than the probiotics you're taking are the prebiotics that you're using. Now, a prebiotic means, of course, to come before the probiotic. And what a prebiotic actually is, it's a substance which either feeds the friendly bacteria directly, or it somehow adjusts the environment in your intestinal tract to make it more favorable for the probiotic to live and then to reproduce. So if you have those in there, you don't have to be looking at specific strains and trying to replace them. You get the basics in there and make sure you're not doing anything to allow those pathogens to come back, like eating foods that might feed them
Mm-hmm.
and allow the trace amounts of them that are there to grow, particularly with Candida. And then when you get your probiotics back, that's that's pretty much what you need to do, with the exception of, you remember on the GI map that you did, there was a panel that went through your intestinal health. It would look at your levels of butyrate. It looked at your pH. It
Mm-hmm.
looked at calprotectin, zonulin, different things like that. That's something that needs to be looked at also, because if some of those markers are indicating either you have malabsorption or you have a lack of short chain fatty acids, which are some of the major prebiotics, or that you might have leaky gut syndrome if your zonulin protein is elevated. Now, in somebody who has leaky gut, it's very important that they don't try to take probiotics in the beginning, because probiotics can react allergically in somebody with leaky gut. When you have leaky gut, your main concern is to kill the pathogens that usually cause the leaky gut and then heal the gut so that your body is able to then handle the probiotics. And it's a funny thing, with leaky gut, you can't really fully get rid of the pathogens when you have leaky gut, and you can't fully heal the gut when you have the pathogens. So it's kind of a race in a sense to do both at the same time, because they're both necessary. If you think about this for a second, if there are pathogens there, the pathogens can further aggravate the leaky gut. And when you have leaky gut, your intestinal immunity is compromised. So killing those pathogens is harder. So you've got to kill the pathogens, but at the same time strengthen your gut integrity to make sure you can fully eliminate them. Now, when you have leaky gut, probiotics can't stick correctly. If you just think about this for a second, if you think about an intestinal tract with all these little cracks in it, how are the probiotics going to stick and hold on if your gut has all these compromised
Right.
openings or spaces? It's not going to happen. So you want to make sure that before you go on probiotics, that you make sure your leaky gut is handled so that you don't take a huge loss on it, because that's what's apt to happen. The person is apt to go on all these probiotics, have bad reactions to them, or have no improvement. Then they're going to say, "Oh, well, this is all baloney." That's because they're doing it wrong.
I'm so glad you hit on the fact that probiotics is not for every situation, not for every person, until you really get to the bottom of what's going on. You
Hmm.
get your GI map, you get the diagnosis. Because when I first started in health coaching, there was this tendency where everybody was saying, go on a probiotic, like across the board. And
Right.
everybody was saying, here are your digestive enzymes, and this is for your gut. And now we know that's not the best way. And I'll have women ask me all the time, should I be taking probiotics? And I'm like, well, that depends. What are your thoughts on supplementation where that's concerned? Should somebody, before they try to supplement, before they go out and buy this and that, should they be having some kind of testing so that they're not making things worse?
The order of things would be to make sure that you don't have a dysbiosis, which means that you have an imbalance between your good and bad bacteria. So when we say dysbiosis, it's an umbrella phrase that's saying make sure you don't have Candida, make sure you don't have parasites, make sure you don't have harmful bacteria in your gut that are imbalancing your probiotics. That has to come first because it's very interesting. And I learned all this the hard way, by the way. I spent years doing it all wrong and having to learn it the hard way. When you have different bacteria and organisms like Candida, they interact with vitamins that you take. And many vitamins will actually spread Candida. And when you take the vitamins, you'll have bad reactions. You'll say, well, this vitamin's no good. I don't know what's going on with this. But it's not the vitamin. It's the fact that you have bad flora and the vitamin is interacting with other life forms living in your intestinal tract. These little microbes, bacteria, virus, candida, parasites, they all interact with the nutrients you take. And this is the reason that we know, as a kind of empirical observation, that people who take vitamins and have bad reactions to them are the people who usually have leaky gut and dysbiosis. So that has to be handled first. Otherwise, you're not going to get the correct effect. But then the question you're bringing up now is, do I need this in the first place? How do I know I need the vitamin that I'm about to buy?
Mm-hmm.
Well, how do you know? Well, the advertising is telling you need it. So what, right? Um, you don't know if you need it. Now, if you don't need it, unfortunately, it can do you harm, which is not what the vitamin companies want any of us to be saying. The vitamin companies want us to say that if you take the vitamin or the nutrient and you don't need it, it just washes out of your system, which is partially true. But the problem is, while it's washing out of your system, it's also taking other things with you, things that you do need. I'll give you an example. Vitamin C will lower your tissue copper levels. The more vitamin C you take, the more copper you need to utilize the vitamin C, and that's also true of manganese. So if you take massive amounts of vitamin C for a long period of time and you don't have the copper and the manganese to support the vitamin C, you end up with a manganese or a copper deficiency. Same thing is true of vitamin E and manganese. Then you have other issues like with, let's say, other vitamins where the same thing is true, where there's an interrelationship, in other words, between all vitamins and all nutrients. There's actually a wheel that a colleague of mine made, which shows you every vitamin and every mineral and whether or not they have a synergistic effect or an antagonistic effect on each other. And if you take a lot of vitamins or a lot of supplements without knowing that you need them based on a test, you can further imbalance yourself, which is kind of the bottom line. So you need to be tested to find out whether or not you need this vitamin. Now, if you're taking a small amount of something, like a multivitamin that has just small amounts or moderate amounts, you might be able to get away with it. But then again, is it doing you any good?
Mm-hmm.
So
True.
the correct thing to do is to go get tested, find out what your levels are of all your minerals, your amino acids, your vitamins. Find out what your levels are. This way, you can selectively supplement and take only things that you need and not something you don't need. And if the practitioner you're seeing is smart, what he's going to do, and this is what I contend that the doctor of the future will do, he is going to do tests on you, which will tell you in real time right now what your nutrient levels are. And then he will do genetic tests on you to tell what your genetic needs possibly could be. Now, the confusion that people have with genetic tests is when a genetic test says that you have a proclivity towards this disease or needing this nutrient, the person immediately thinks that's happening right now to them because the test says it. You have to understand a genetic test doesn't tell you what is happening, it's telling you what could happen. In the future, as your telemeters are clicking, when those gene expressions begin, then that's where you have the issue occurring that's showing on the test. It's not just when you get the test and you see, wow, I have the gene for arthritis and I'm supposed to be taking this vitamin, so I must have arthritis and I have to run out right now and get the vitamin. That's not what a genetic test tells you. A genetic test tells you what you're genetically programmed or tending towards based on your familial background.
Mm.
So if he has a test that's telling you, for instance, like what your vitamin C levels are, and then he has a genetic test, and the genetic test is saying that you have a very low need for vitamin C because you don't have any genetic errors in your body that would cause you to use up massive amounts of C, well, then you know that you can take enough to bring your levels up or keep them at a normal level, and you don't have to worry about it after that. But if he has a genetic test that's saying that you have gene expressions which use up massive amounts of vitamin C, and right now your test is showing your vitamin C levels are low at that moment, now you know this is something you need to be on top of.
Right.
See, so both of these tests have to be used. You have to have a test which could tell you what could happen, and you have to have a test that's telling you what's happening now. And then you look at those and you jockey that back and forth in order to come up with your own personalized program.
Mm. I agree with you. I think personalized medicine is what we have coming in the future, where
Hmm.
it is personalized for you, your needs, your genetics. But now, okay, let's say somebody, they're listening to this, they're like, oh, I want to get tested. Now, I know more than likely the doctor's not going to order the genetic testing, but what should they be asking for with the nutrient testing? Is there a specific test or panel of tests they should be asking for?
There's actually a few, and it would depend on. But the problem is that your doctor doesn't know any of this, which I'm sure most people listening already know. So a doctor will tend to poo-hoo all of this nutritional medicine unless he is hip and he's looking. The doctor himself is on the internet. He's on Instagram. He sees people like Dr. Oz or Dr. McCullough or myself or somebody talking about this. Um, but that's the problem is that they're not hooked up to the labs. They use LabCorp, they use Roche, they use labs that don't do this type of testing. So the best thing the doctor could do would be to refer you to a clinical nutritionist or a body coach or somebody, a functional medical doctor who does this type of testing.
Okay.
Because going to
Yeah.
their doctor is usually going to be a waste of time. He doesn't have time for this. It's like people ask me all the time, why don't doctors handle Candida? Okay, well, here you've got this doctor is prescribing antibiotics and steroids and hormones, which are probably causing Candida in so many people. And he comes in, he sees you for 5 minutes. His physician's assistant does most of the work. How is he going to explain to you about Candida? How is he going to explain to you how you might feel or react when he puts you on a Candida program? How is he going to handle all your questions about the Candida diet? So for a doctor to handle Candida or to handle nutrition, he has to have another practitioner in there who works underneath him usually, who's going to do all this. He doesn't have the time. The typical length of a consultation to really explain to the patient how to do their program, answer their questions about diet, et cetera, is going to be at least 30 minutes. He doesn't have 30 minutes. He's used to saying, well, maybe 10 or 15 patients an hour. So he doesn't have that. So this is why I would say you need to find somebody who's a certified clinical nutritionist, a life coach, a functional medical doctor. Many chiropractors do this. And that's the way you have to go, because if you go to your doctor and ask him about this, he's probably going to poo-hoo it because he can't do it.
Right. Right. I agree with you 100%. And really not their fault. They're not trained. They don't have the time. They're dealing with the insurance companies, which is a
Hmm.
whole other topic
Yeah,
in and
that's
of
true.
itself.
Yes.
And so yeah, it's a heavy burden on them. And they're really not trained in nutrition. They're not trained in, like you said, candida or any of these gut health issues. And so, yeah, going to them is you're probably not going to get the answers or the testing that you need. I know I've been fortunate enough to have a nurse practitioner since I was 51 and I'm 64 now. who takes that time. But when I go to her office, we're talking about 45 minutes, sometimes close to an hour,
Hmm.
while she just goes over everything in detail and she orders tests that they don't do. Like if I go to my regular practitioner through the insurance company, the testing is so simplistic. I'll give you an example. So they'll test cholesterol. Here's your good cholesterol, here's your bad cholesterol, but they won't test, for instance, for LDL particle size,
Right.
which, as you know, can be
Hmm.
more important than just that number. And most people don't, they really don't know this.
This is true.
So, how do they find? What are your suggestions for finding a practitioner? Because I know some complaints that I've heard is that it's too comprehensive. They go to a functional medicine practitioner and the testing is so expensive. They're running every test and hair tests and mineral tests and all these things. It's overwhelming. It's expensive. The
Hmm.
supplementation is expensive. What is a simpler path for people?
Probably for the person to really do their research and go to the doctor with a specific plan in their head of what they want to get out of this. But that doesn't mean the doctor may find something that they don't know about, which might be a real um, toadstool in their way. Maybe they may have various loose floorboards, so to speak, that they're not aware of or don't know. Well, let's say if we get somebody who's reading about arthritis, and they learn all about what the nutrients are involved and whatnot, but then they go to a doctor, and the doctor says, well, the reason you have arthritis is because you have candida and leaky gut. Well, that's something they're then going to have to accept and take the expertise of the doctor and just not be insistent of just treating them for arthritis when they're not treating the underlying problem. So I think the answer to the question is for the person to do their research on what's going on. And but that's a tough call. That it is. There is something to be said for comprehensive testing, because when you do very comprehensive testing, you're hopefully not missing anything, and you're finding not only the mechanism of the complaint the person has, but you're also finding out what the underlying problem might be. But I can tell you that in my methodology, what I do with patients is I have a pretty strict code in terms of how I handle things, because I've learned over the last 40 years that this is the most efficient way to handle things. So what I always look for first in the person is, do they have a dysbiosis? And I'm going to handle their dysbiosis first and foremost. I'm not going to get involved in giving them 8 million supplements to take to handle everything that's wrong with them. Or give them, and this is the worst scenario that I saw last year in a patient who came to me from another functional doctor, is the functional doctor had put them on all these supplements based on their genetic test for problems they didn't even have. The genetic test was saying they had this and this possibility. So the doctor had them on all these supplements recommended by the lab to handle those problems, but those problems had not yet manifested. That's the worst scenario. So I handle the person's dysbiosis first. I want to make sure they don't have candida, they don't have any kind of dysbiosis, and they can absorb. When I give them a vitamin, they can absorb the vitamin correctly. The next thing I look at is toxicity, because toxicity is one of the things that causes dysbiosis, and it's one of the things that also blocks all the vitamins from working correctly. So we look for metal toxicities, we look for chemical toxicities, and if we find those, we try to find the source so that the person's no longer directly exposed to this toxicity, and then we put them on a program to get these toxins out of their body. Then once we do that, we look at all their vitamins and their hormone levels, and now we seek to balance anything that's out of balance. And I think that's the correct order to address things, because if you do it out of order, those things don't work. You see, if you try to balance somebody's vitamins while they're exposed to toxicity, the toxicity just keeps blocking the vitamin.
Mm-hmm. It does.
If you try to handle their dysbiosis, let's say, and you don't do it correctly, now they can't absorb the nutrients. So when you look at how the body is set up, the intestinal tract is where you absorb your nutrients. It's where you do a lot of detoxing, and the intestinal tract influences your hormones. So if you have bad biome, that can throw your hormones off. You may not be utilizing the hormones correctly. So if you don't do it in the order, this basic order, handle dysbiosis and your gut, handle toxicity in your body, then balance your nutrients and your hormones. If you do it in that order, you're doing it in a somewhat a segregated manner that makes sense, that's not overwhelming the person by trying to do it all at the same time.
Yes, step by step
Mm-hmm.
and in a certain order. I could not agree more. My nurse practitioner has been really good with that. We do a step-by-step process where she'll say, this is what I think we need to do first. And then
Mm-hmm.
there's second, there's third. And
Right.
it's not overwhelming. I'm just following the protocol and what she tells me that I need to do in that period of time to clear things up. And that's what we did after my GI map, the last one that I had done. And I want to talk a little bit about the brain and the gut connection. That's been really interesting me lately. I recently ran a coaching meeting for a colleague. We were
Mm-hmm.
talking about stress management, the effects of stress, in particular on midlife women. And we were really diving into that gut brain connection. Can we talk a little bit about how they interact? Like, how is the brain affecting the gut? How is the gut affecting the brain?
Well, it occurs in a few different ways. One, from the absorption of nutrients. If you don't properly absorb nutrients and utilize them, then you don't have those nutrients to correctly balance your hormones or your neurotransmitters. But neurotransmitters and hormones interact with your biome. So if you don't have a correct biome, the neurotransmitters don't work well. And if you want to take it to the extreme, when we start talking about medications that affect your neurotransmitters, some of the medications that people take to try to balance their neurotransmitters kill your flora,
Mm-hmm.
which is that's not so good, because now you're creating another problem. So for each like amino acid you look at, amino acids are precursors to neurotransmitters. And if your gut biome is correct, you don't utilize or absorb that amino acid, so that neurotransmitter may not properly work. So the neurotransmitters working in your brain, and the biome is the gateway for that to come in and be produced. A lot of nutrients, a lot of neurotransmitters are actually produced in your gut, which people don't know. So if you take tryptophan, the conversion of tryptophan into 5-HTP takes place in your gut and in your liver. And if you have a bad biome, that doesn't happen. So that affects your brain. That drops your serotonin. It's a funny thing. I noticed this years ago that people who were constipated tended to be depressed.
Mm-hmm.
And when their constipation went away, they all remarked, gee, I feel so much better. I don't feel this sort of depressed fatigue that I used to have all the time. And they would say the only thing that I can really notice that's different is my bowels are now moving several times a day where they used to move every few days. Well, why is that? If we think about that for a second, their bowels are moving more. So if their bowels are moving more, it automatically means there's an improvement in the pH of their intestines. It's got to mean that their intestinal flora is better. So what's happening by their bowels moving more, they're creating more of the correct neurotransmitters, or they're balancing the neurotransmitters that they were low in that was causing their depression. That's simple.
Yes. Yes. I agree. I've seen that too, where I'll have a client who is suffering from chronic constipation. And typically there's some depression there as well. And I've
Mm-hmm.
often wondered how many mental health problems are made worse by poor gut health, how many are even caused by
By
poor
poor.
gut health.
Yeah.
And autoimmune disease, that's another one. I've often heard that can begin in the gut with problems there as well.
I would say that all autoimmune disease begins in the gut. And it begins not only with dysbiosis, but then, of course, having leaky gut syndrome. It's very rare that I find anybody who has elevated C reactive protein or an elevated SED rate or elevated ANA who doesn't have leaky gut.
Mm, I agree. I have RA. I was diagnosed with RA many, many years ago. It's been probably 10 years now. And they said it was slow developing. And it's funny because, hindsight's 2020. I can look back to my starting about age 45, and IBS was the first thing, was the first sign, but I didn't know. I didn't know what I know now. And I do believe that that's when it was starting to develop, right around that time where I was having major gut health issues. And then here came the diagnosis. So I agree with you there. Reversing autoimmune. Do you think people can reverse autoimmune?
We do it routinely in my practice. It's very simple. What you do is you handle the gut dysbiosis, you handle leaky gut if it's there, and then you handle that toxicity, which then also can trigger it. Again, that's why I do it in that order.
Interesting. I know one of the best things I did was go alcohol free.
Hmm.
Back in, January 1st, I went alcohol free. And I've noticed my gut health being profoundly better since I
Alcohol
did that.
feeds a lot of bad microbes,
Sure
and it
does.
also it inhibits the probiotics. So that would make perfect sense. But another side to that, though, compared, because then you'll get other people talking about other types of recreational drugs. The one thing we can say about alcohol is your body over thousands of years has developed enzyme systems to naturally handle it because your intestinal tract produces alcohol normally. So your intestinal tract is familiar with alcohol, and it has enzymes to break it down, where there are other drugs your body has no clue of what to do with, and that's one of the reasons why they're so dangerous.
What are those?
The other drugs,
Mm-hmm.
I guess just about anything you'd want to pick. Anything from cocaine to anything that's an opiate receptor activity, any drug. There's your body does not have enzyme systems to handle virtually any drug other than alcohol.
Interesting. That I didn't know
I
about the
didn't know
alcohol.
I didn't know that either until a while ago, because and the reason, but it goes back to the biome. The reason is because there are naturally occurring bacteria and naturally occurring yeasts which live in your intestinal tract that are minor parts of that biome, and they naturally produce alcohol. The extreme of that is when you have really severe candida and you have the alcohol levels increasing because there's so much candida there.
Mm.
That's a byproduct of candida is alcohol.
Oh, really?
Candida eats, well, it's like a brewery. Your Candida eats your sugar, eats your
Oh, yeah.
carbs, and what does it
Mm-hmm.
do? It makes alcohol from them. So your body over thousands of years has had to learn to produce enzymes to
Okay.
detoxify that alcohol produced by your intestinal tract. So alcohol is the only thing that's the only drug, quote unquote, that is not foreign to your system. But your body has no natural enzyme systems to handle cocaine or marijuana or prescription drugs necessarily at all, because they're not native to the body's own function, which is very interesting when you look at it from that viewpoint.
It really is. So things like antidepressants, anti-anxiety, and I'm not saying, suggesting people go off their medications, but some of these things, painkillers, I would think would be a
Hmm.
big one. People take painkillers,
Hmm. This
or
is true.
even ibuprofen, I
Right.
would think would
You
have a
you
profound
really you
effect.
really hit on it before, Carol, when you were talking about how many people are on various medications for, let's say, depression or whatever the problem is, and it's actually hormonal or something that's more, let's say, if you want to, if we want to call it physiological or nutritional related. It's stunning. I started to introduce the subject when I talked about the constipated people who were depressed. But there are so many women who end up on all types of psychiatric medications because they have bad PMS, or
Mm,
they have depression due to
yeah.
their hormones being imbalanced, and they don't have a Prozac deficiency. They don't have a deficiency of any of these drugs. Their problem literally is their hormones are imbalanced, or their hormones are being thrown off by the toxicity in their environment and the plastics. We go back to that again, and they don't need these drugs. Their problem is of a different nature.
Yeah, it's very common. A woman goes in with these certain symptoms, even menopause or perimenopause, and then she comes away with all these medications. I've seen it because women fill out a form for me that they're taking this, this, and this.
Right.
I remember one woman in particular, she had just turned 50. She was on a birth control pill. Now, granted, had already gone through menopause. She was on a birth control pill, antidepressant, anti-anxiety, and Ambien.
Hmm.
And I was like, oh my goodness. And trying to help her with her fitness goals, her physique goals, it was like this uphill battle. It was like trying to dig this big hole with this,
Yeah.
teaspoon
Right.
because it was so convoluted. She
Yes.
was taking so many different things. I'm sure it was affecting her gut. Yeah, it's just shocking,
Yeah.
what some people are on.
What people don't know is all these medications that they're being told to take that are antidepressive or whatnot, they're further taxing and imbalancing your nutrients in your body. Because the way most drugs work, now I'm probably going to get a lot of mail on this, but in actuality, the way most drugs work is drugs work by creating a partial deficiency in your body. And the reason why that is because the drug is trying to suppress a symptom. So it's trying to block a pathway. So in order to block the pathway, it has to create a deficiency or block a nutrient. And then that's how it comes about. If you look at great example is Viagra. Viagra elevates your nitric oxide levels, but it does it by
Hmm.
blocking the enzymes that break down nitric oxide. And there are many other examples in other drugs. That happens to be the first one that came to my head. But it's actually creating a deficiency by blocking that enzyme. So these women who are taking all these medications, their problems could be handled by going through the type of treatment that you and I are proposing by just getting themselves balanced, if we want to call it that. They probably could come off all those drugs. But again, that takes more time and effort, and it takes somebody to test them, to show them what the imbalances are, and then have the time to explain the program. So we're back to that problem now, is that these doctors they're going to see don't have the knowledge or the necessarily the inclination to put them through a program to correctly handle these things because they're not trained and they don't have the time. They already have their narrative of, you come in, you have a headache, I give you this. Well, where's the headache? It's on this side. Okay, here's the pill for the headache that's on this side of your head. If you ever get a headache on this other side of your head, come in, I'll give you the other pill for that side of your head. That's the mentality that we have, unfortunately.
Yeah, it's quick.
Mm-hmm.
You've got that 5-10 minutes that they have with you. 10, if you're lucky. I think it's more like 5. At
Yeah,
least it is in New Mexico. They're overwhelmed here. We're short of doctors, and it's easier to just, okay, let me call in a prescription or write a prescription and not take the steps. And again, not their fault. I really, really believe that they're kind of stuck really
yeah.
in this system, in this pattern that we're in, and
It's how
there
they've been
has to be a better
educated.
way.
And
Yeah.
the drug companies perpetuate all this, of course, because they want to make money. But I don't even know that I could tell you how many people in the 40 years that I've been in practice, I've gotten off psychiatric medications not by doing anything heroic, just by doing simple things, by getting them back in balance. Either finding they had dysbiosis that was affecting their ability to use their neurotransmitters, by finding they had a deficiency in some mineral that was a cofactor to a neurotransmitter that was causing their symptoms. So, because for every neurotransmitter you get into, all neurotransmitters have precursors that are amino acids, and they have cofactors that are vitamins and minerals, which are enzymes that help that neurotransmitter to work. So sometimes you find the darndest things. I had a person once with chronic depression, and I found out their problem was they were low in magnesium and copper, which were cofactors to their body's ability to utilize dopamine. So when you just do these simple things, sometimes the person will find out that they really don't need the drug anymore because you've handled the imbalance that was causing the apparent need for the drug. And they end up saving a lot of money not having to take those drugs, which are really expensive.
Yeah, I
That's
know
the other side.
magnesium is a big one.
Hmm. Probably the
Most
biggest
people.
deficiency we have in the country is magnesium because it's depleted by sugar, stress, and alcohol, which are things that a lot of people encounter.
Should we be taking, because there's several different types of magnesium. I get this question a lot. I take a blend,
Hmm.
and then I have one that's for brain health. should we be taking a certain type? Should we be taking a blend? What do we do there? Because that's a little confusing.
Well, I think the first thing you want to do is you want to look at your magnesium levels to first see whether or not you need to take it in the first place. And one thing people need to be careful of is vitamin D. If you take too much vitamin D, it interferes with magnesium assimilation.
Mm.
So if you do a hair test on somebody and you see their magnesium is really high, one of the possibilities is they could be taking excessive vitamin D, or they might have the vitamin B6 deficiency, which helps you utilize magnesium. But I would say look at your magnesium levels and then determine, based on some of your symptoms, which we're lucky we can do this now, what form of magnesium might work best for you. Is it magnesium threonate? Is it magnesium with taurine? Or is it just a magnesium glycinate, which is magnesium glycinate is arguably the best absorbable, but
Hmm.
some of the specialized ones could help you with particular idiosyncrasies you have going on. So that's always good to look at. But
Really
first
good
check your
advice.
levels. First check your levels. Because sometimes the problem isn't that you need the magnesium, but it's that you need to take less vitamin D or take more vitamin B6 as an example.
Mm. Yeah, that's really good advice because I think vitamin D got a lot of attention on social media and the press, and all of a sudden everybody was taking copious amounts of it, and maybe they didn't need copious amounts of it. And yeah, so I agree with you
Well,
there.
they changed the reference range for D about 15 years ago.
Oh, they did not
Yeah,
know
the,
this.
the, the reference range for vitamin D was changed. And it turns out that if you're not taking a vitamin D supplement, you're going to always score that you're below normal, is the interesting thing about it.
Really?
Vitamin D, the reference range it used to match a clinical diagnosis where the D would go so low that you develop rickets. Rickets was the hallmark symptom of vitamin D deficiency for many years. And the medical range for vitamin D was set up in that manner. They looked at where D would drop to the point where you would get rickets, and that was your bottom line. But then when all the research started to come in about the good effects of vitamin D on people that they didn't know about, they decided to raise the range so that it ended up being that if you're not taking a D supplement, you're going to be deficient per the new range that's in the last 20 years or so.
Good to know. Did not know that.
So,
Dr. Biamonte, this has been a great discussion, really full. Was there anything we didn't cover that you want the listeners to know?
no, I think we're good. I think we hit on the main points. I think we hit on them.
Yeah, we did. We covered a lot. How can listeners and people watching get a hold of you?
They can find me online at my website, health-truth.com. Also the New York City Candida doctor and the New York City thyroid doctor, and they can also find me on social media.
Great. Thank you so much, Dr. Biamonte. It's been an absolute pleasure. So good to have you back on the show.
Thank you, Carol.
And to our listeners, we wish you every blessing. Bye for now.